The most common cause for acute back pain in young people is due to disc prolapse. I will explain. Now I am going to talk about acute back pain. This can happen both in old and young. There are many reasons. I am going to describe a few of those. The most common cause for acute back pain in young people is due to disc prolapse. I will explain what is this disc prolapse is. If you take your spine, it consists of a number of vertebrae. We call these the bony part, which is called vertebrae. In between, there is a cartilaginous disc. It is in the lumbar region. We call it lumbar disc. It is in the thoracic region. We call it thoracic disc. So it is very common to have diseased disc in the lumbar region because that is the area we are mostly subjected to the movement, whereas in the thorax it's very much minimum. So therefore, there can be certain damages that can occur in the lumbar disc. There is a covering which is called annulus. In the annulus, there can be some tears. This happens particularly when the patient bending forward and doing things for a longer period, as well as if lift a heavy weight. Usually the pain does not come on the day itself. You can have mild pain when you are lifting, but most patients complain the pain in the next day, maybe after 12 to 14 hours or in 24 hours later. That is due to first thing that happens is the annulus tear. That is the fibrous capsule surrounding the disc, which is containing within the disc. So if you get this fibrous capsule tear, you get a milder pain. And next day, the disc material start extruding out, and that will travel down to the spinal canal. And here in this foramen, we find the exiting nerve roots to the leg. We call it sciatica. So this material can irritate the nerve that is traversing at this exiting foramen. We call it sciatica. So the mainstay of treatment here is to reduce the pain by giving pain medication, injections, or whatever it is. Most of the time, it resolves on its own within 1 or 2 weeks. It is the hardest part is to bear this pain. You have to have some pain medication along. Apart from that, the patient can have some external applications like anti-inflammatory pain medication tubes available on the pharmacy, as well as we can put ice, as well as you can ferment. And so during that time, the patient should abstain from lifting weights and bending forward. And if the hump body is doing work which is related to lifting weights and a lot of traveling, we advise them to be off work for about 1 or 2 weeks. And 90% of the time, you are okay within 2 weeks. Therefore, you should not get alarmed most of the time. There is a group of people who do not get better with time. So that is, I would say, which is less than 10%. Those people will ultimately go into further investigations like MRI scan. Then we can detect where the disc prolapse has happened, or when there is some bony changes also we can detect. In certain situations, we find this spondylolisthesis in certain patients. So that's a different pathology. Then the MRI will detect where the disc and where the which nerve root is compressed. Then we can offer them surgery, but we can delay as much as possible because this is not a must surgery. 80 to 90% get better without surgery, and only 10 to 20% will go into surgery.